Welcome to the most comprehensive Health Check 911 masterclass we have ever produced. Today, we are embarking on a definitive deep dive journey into type 2 diabetes, a condition that has dramatically shaped medical history and now poses a global health challenge of truly unprecedented scale. Across the globe, over 800 million people are now living with diabetes. In the United States alone, nearly 38 million people are affected. Yet millions more remain entirely undiagnosed, living their daily lives on the absolute edge of a metabolic crisis. The history of diabetes spans over 3,500 years. The earliest records come from ancient Egypt, where physicians described a mysterious malady characterized by the passing of too much urine. In ancient India, it was known as madhumeha, or honey urine, because physicians noticed the urine was sweet enough to attract ants. It was a condition that, for millennia, remained a death sentence. To appreciate where we are, we must look back. For millennia, diabetes was a fatal mystery. Everything changed in 1921 when Frederick Banting and Charles Best discovered insulin, transforming a definitive death sentence into a manageable chronic illness. Despite a century of progress, type 2 diabetes remains a silent predator. It develops slowly, often causing internal damage for years before a single symptom is felt. Prediabetes is the critical, fleeting window for intervention. Over 1 in 3 adults is currently in this state, but an astounding 80% don't even know it. Recognizing the warning signs during this phase can literally prevent a lifetime of severe complications. To fight this condition today, we must understand the cellular science. Insulin, produced by your pancreas, acts exactly like a key. Its primary role is to unlock your cells to allow life-sustaining glucose to enter and fuel your body. In a metabolically healthy body, insulin binds perfectly to specific receptors on the cell surface, immediately signaling the energy gates to open. This flawless microscopic process powers every single function, from your heartbeat to your deepest thoughts. Type 2 diabetes occurs when this delicate gateway completely fails. The body develops insulin resistance. The keys are present in the blood, but the locks are jammed. The cells essentially turn deaf to insulin's signal, leaving glucose stranded in the bloodstream. Your pancreas senses the rising blood sugar and attempts a rescue. It goes into massive overdrive, pumping out huge amounts of insulin. But this state of constant overwork inevitably leads to beta cell exhaustion, permanent damage, and cellular death. This state of overwork leads to beta cell exhaustion. Over time, these vital cells become damaged and may die, leading to a permanent decline in the body's ability to produce insulin. Compounding the problem, the liver makes a critical error. Sensing that the body's cells are starving for energy, the liver begins dumping even more stored glucose into the blood, rapidly accelerating the systemic energy crisis. With the pancreas failing and cells remaining resistant, sugar builds up in your bloodstream. This chronic hyperglycemia becomes toxic, damaging blood vessels and nerves throughout your entire body. Your body will try to warn you, but you must know what to listen for. Let's break down the 8 critical warning signs your body is sending you right now. Sign 1: frequent urination. When blood sugar is high, your kidneys filter the blood frantically. They flush out the excess glucose, pulling large amounts of water along with it. Sign 2: excessive thirst. The massive fluid loss from frequent urination leads to deep systemic dehydration. Your brain triggers an intense, unquenchable thirst as a desperate survival mechanism to replenish the lost water. Sign 3: extreme hunger. Because glucose is trapped in your blood and cannot enter your cells, your physical tissues are literally starving for energy. Your body responds with constant, powerful, and overwhelming hunger signals. Sign 4: persistent fatigue. Without its primary energy source, your body's systems severely struggle to function. You may feel a heavy, overwhelming exhaustion that sleep cannot fix. Sign 5: blurred vision. High glucose levels pull fluid from the lenses of your eyes, causing them to swell and distorting your ability to focus properly. Sign 6: slow healing wounds. High sugar levels impair circulation and cripple the immune system, meaning minor cuts or scrapes can take weeks or months to heal. Sign 7: tingling or numbness. Chronic high sugar is toxic to your nerve fibers, causing them to misfire and leading to pins and needles sensations in your hands and feet. Sign 8. Unexplained weight changes. When your body can't use sugar for fuel, it may start burning muscle and stored fat, leading to sudden, unintentional weight loss. And watch for acanthosis nigricans, dark, velvety skin patches in the folds of the neck or armpits. This is a visible physical hallmark of severe underlying insulin resistance. If these signs are ignored, the internal damage accelerates. Sugar damages the arterial lining, leading to plaque buildup and a massive increase in heart attack and stroke risk. The kidneys are equally vulnerable. High blood sugar destroys the tiny, delicate nephrons that filter your blood, eventually leading to chronic kidney disease or total renal failure. Your eyes face diabetic retinopathy. Sugar damages the microvessels in your retina, causing them to leak or grow abnormally, which can result in permanent vision loss. Daily management is vital. Poor circulation and nerve damage mean minor foot injuries can go unnoticed and lead to severe infections or even amputation if not checked daily. We must also recognize ethnic disparities. People of South Asian, Black, Indigenous, and Hispanic descent face a significantly higher risk of type 2 diabetes, often starting at a younger age. In South Asian populations, for example, the risk can be up to 6 times higher. This is often due to visceral fat around the liver and pancreas, even in individuals who appear lean. A massive part of management is mental health. Over 70% of people with diabetes experience diabetes distress, the profound emotional burden of managing this condition 24/7. Modern science focuses on metabolic flexibility, training your body to switch efficiently between burning sugar and burning fat for fuel through fasting and strategic activity. Your gut microbiome is also a key player. A healthy microbiome sends signals that improve insulin sensitivity, while an imbalanced microbiome can trigger systemic inflammation. Even the timing of your meals matters. Circadian rhythms regulate glucose metabolism. Late night eating or disrupted sleep cycles can significantly worsen insulin resistance. Breakthrough medications like GLP-1 agonists are changing the landscape. They mimic hormones that stimulate insulin and send powerful satiety signals to the brain. At the molecular level, these agonists bind to specific receptors, promoting weight loss and dramatically reducing the long-term risk of cardiovascular disease. Similarly, SGLT2 inhibitors protect the kidneys by blocking glucose reabsorption, allowing the body to flush excess sugar out through the urine. The primary cause of type 2 diabetes remains excess visceral fat. This tissue is metabolically active, releasing signals that directly block your body's insulin pathways. Chronic stress acts as a catalyst. Stress hormones like cortisol force the liver to dump glucose, creating a dangerous feedback loop of high sugar and physiological stress. But there is hope. The Diabetes Prevention Program study proved that simple, structured lifestyle changes can reduce the risk of developing diabetes by a massive 58%. The most powerful tool is modest weight loss. Losing just 5 to 10% of your body weight can restore insulin sensitivity and profoundly improve your health. Incorporate more fiber. Fiber acts as a biological mesh in your digestive tract, slowing sugar absorption and preventing dangerous glucose spikes. Master the plate method. Fill half your plate with non-starchy vegetables, 1/4 with lean protein, and only 1/4 with complex carbohydrates. Become a label detective. Watch for hidden added sugars and high total carbohydrate counts in processed foods, which are the primary culprits in metabolic decline. Understand the glycemic index. Switch from high GI foods that spike your sugar to low GI options like lentils that provide slow, sustained energy. Small swaps make a massive difference. Choose snacks like raw nuts or Greek yogurt instead of sugary bars to keep your blood sugar stable throughout the day. Movement is medicine. Exercise triggers a unique biological pathway that allows your muscle cells to absorb glucose directly from the blood, even without insulin. Incorporate strength training. Increasing your muscle mass creates more glucose sinks in your body, providing a powerful long-term defense against resistance. Master your A1C numbers. This test reveals your average blood sugar over the last 3 months, serving as the gold standard for tracking your management. Aim for the healthy range. Knowing exactly where you stand, whether in prediabetes or diabetes territory, is the first step toward taking corrective action. Success requires a team. Work closely with your healthcare providers to optimize your medications, diet, and monitoring for the best possible outcomes. Remember, the ultimate goal is remission. For many, intensive lifestyle changes and weight loss can return blood sugar to normal levels without lifelong medication. Your health is your greatest wealth. The choices you make today, one meal at a time, one walk at a time, will define the quality of your future. Start your journey today. If this masterclass was helpful, please like, subscribe, and share. Your life matters, and prevention starts today. Hit like and subscribe for more health and preventative information. Take charge of your journey. Visit healthcheck911.com for the full written guide and extra resources. Your journey to vibrant health starts today.